So am I so that we can start the session now? Okay. So yes, am I audible? Let me just check so that we can start the session. Yeah, so I am audible. So everything is clear. So yes, this is the session which is targeting for the NEET PG 2022 examination, and we are here to must know anatomy topics with the MCQ session 6 targeting NEET PG 2022. So my dear aspirants, myself Dr. Monalisa, MD Anatomy from Armed Force Medical College Pune. I am here, anatomy educator, and will discuss all the important topics here. So before that, let me give you a brief introduction about the platform. It's an interactive session where the learners and the educators interact. Polls are conducted. You can respond to the poll. You can raise your hand, get your doubts clear, write itself when the session is taking place. Never ever miss a session. Lecture notes and PDF downloaded. Once the session is finished, you can also download the PDF notes, and this is highly beneficial. I would also like to tell, read from anytime, anywhere with the top educators of Unacademy platform. So let's talk about the All India mock test. So my dear aspirants, All India mock test NEET PG 2022 is going to happen on 26th Feb. So what is the timing, dear? It's 9 AM 26th Feb. So just log that date and do present live, because after the completion of examination, you will get the exact pattern of examination going to happen right now, and also video solution for each and every MCQs will be given by the top educators of Unacademy platform. Let's talk about the plus subscription. All 19 subjects are completed in a very systematic way. You can assess both live and recorded version. You can study from India's top educator, compete in live tests, stay on the device, assess more than 25,000 MCQs. My dear aspirants, all 19 subjects, 25,000 clinical MCQs. That means you are going to solve these MCQs, and that would be highly beneficial for you. So do if you want, you should take the plus subscription, and it will be highly beneficial, and you can cover all 19 subjects in a very systematic way. Use my code NAT10 and get an extra discount of 20%. What about iconic subscription? Unacademy and the Prep Ladder has merged together, so you can have an access to two best platforms, okay? Well structured batches, recorded lecture, few syllabus, the full syllabus, QBank 25,000 MCQs, and also the dream notes of the Prep Ladder dream team with a QBank 3 clinical video lectures, integrated sessions. All these can be solved by you. Congratulations to the toppers of FMG December session 2021. I wish them best of luck so that they can target their examination of NEET PG in the first go with a very good rank. Now, my dear aspirants, till 27th of Feb, I am showing you all the timetable of the test. Please don't miss any of the session, because it will be highly beneficial for you. Introducing NEET PG notes. So my dear aspirants, now this is a great offer for all those who are going to take the subscription. They will also be provided with NEET PG notes, which is made by the top educators of Unacademy platform. And my dear aspirants, if you are going to take the subscription of 1 year and more, then only you are definitely getting the printed notes of the Unacademy. Focus FMG 22 comprehensive batch is on for 4 months. So you can take the you can be the part of these session. Target next 22-23 subject wise is on, so you can be the part of these series. Boost your medical preparation. Okay, so this is just valid till 23rd of Feb. Taking the subscription with 3 months, 1 month is free, 12 months, 2 months is free, with 36 months, 6 months is free. So use my code NAT10 and get an opportunity of an extra discount of 10%. So let's start with the session now. A 45-year-old male is brought to the emergency department, okay, and he complains of sudden periumbilical pain. Okay, what is the key point? Sudden periumbilical pain, okay. So which after some time is radiated to the lower right quadrant of anterior abdominal wall. The patient was taken into the surgery, and a part of mesentery was cut. The blood vessel is ligated to stop the bleeding. Okay, what might be the origin of the ligated artery? So my dear aspirants, we have got 4 options, and you have to go with the correct answer. So see here, this is inferior mesenteric artery. This is option A. Right colic artery option B, ileocolic which is the option C, sigmoid artery option D. So you can see 4 options are there, and to proceed for the correct answer I would like to give you the keywords. So what are the keywords which will be taken into account? What are the keywords which you are not going to miss out? Periumbilical pain, periumbilical pain, and after some time the pain is radiating to the right lower quadrant of the anterior abdominal wall. Got it? Means periumbilical pain is the presenting complaint, and after some time the pain is also radiating to right lower quadrant of the anterior abdominal wall. The patient was taken into the surgery and a part of mesentery was cut and the blood vessel was ligated to stop the bleeding. So what might be the origin of the ligated artery? So the origin is from inferior mesenteric artery, right colic artery, ileocolic artery or sigmoidal artery. We have got 4 options. So my dear aspirants, those who can you give the answer? So try, otherwise I will come up with the explanation. So after this, after seeing this key point, periumbilical pain and right lower quadrant of anterior abdominal wall, actually this clinical scenario is the presentation of which case? It is the presentation of acute appendicitis. So this is a case of acute appendicitis. This is a case of acute appendicitis, and in this case the appendix is inflamed. So in this case the appendix is inflamed. Now the other key point which is giving us the correct answer is periumbilical pain is referred to the is involving the appendix, and we know that pain of the appendix and umbilicus are around the umbilical region. The reason is that, okay, appendix and umbilical region, the relation of both of these is because both of these are innervated by the segment, T10 segment. Okay, so periumbilical pain was referred to the fact that the umbilicus level and the appendix is having same innervation. What is the innervation? The innervation is by the T10 segment of the spinal cord, T10 segment of the spinal cord. Now my dear aspirants, when the pain is increasing, the pain is radiated to right iliac fossa. So please write down these key points, then see here. I am showing you this diagram where you can see the pain of appendicitis has been shown, and from the umbilical region it is shooting and going towards the right quadrant, lower quadrant of the anterior abdominal wall and the right iliac fossa. It is radiated, and the innervation is by the same segment, that is T10 segment. Now this is due to involvement of parietal peritoneum, and the next important point is the supply. Next important point is to know the blood supply of the appendix. So see here, actually the blood supply of appendix is from the appendicular artery, and appendicular artery is a branch of ileocolic artery. So let me show you that. See here. So you can see here, this is superior mesenteric artery, which is a ventral branch of abdominal aorta, superior mesenteric artery. It is giving ileocolic artery, and from ileocolic artery we have got the appendicular artery. So ileocolic artery is the best answer, which is giving rise to appendicular artery, which give blood supply to the appendix. So that would be involved in this case. So coming to the right answer, so we have got the correct answer, ileocolic artery. In this case, ileocolic artery is the right answer. Why? Because appendix is inflamed, so the blood supply of appendix is affected. Appendicular artery itself is a branch of ileocolic artery. So we have got C as the correct answer. Let's move on to the next one, that is question number 2. External laryngeal nerve. All those who are listening can mark the correct answer. External laryngeal nerve. Okay, external laryngeal nerve, or 23-year-old man becomes inserted and tightly compressed, okay, tightly compressed by the tortuous superior thyroid artery, which parallels the course of the nerve. Which of the following function is most likely affected? Okay, so yes, am I audible? So my dear aspirants, can you hear me nicely? Okay, so let me just check. Am I audible? So I am talking about the second MCQ. Let me just check. So this is the second MCQ. Okay, and here the external laryngeal nerve of 23-year-old man is tightly compressed by tortuous superior thyroid artery, which parallels the course of the nerve. Which of the following function is most likely affected in this condition? The options are sensation above the vocal cord, sensation below the true vocal cord, abduction of vocal cord, or tension of the vocal cord. Okay, so yes, I got an answer from Shweta Lohia. Yes, okay, I was slightly confused what happened. So am I audible correctly or not? I was just checking. So my dear aspirants, here also you have to come up with the right answer. So already I have targeted A, B, C, D. So you can mark your answer. I will give you 30 seconds or I will come up with the explanation. So according to you, what is the correct answer here? So here are the key points. So firstly, I would like to tell you about the key point. The key point which is marked here is the involvement of superior thyroid artery. So here there is involvement of tortuous course of superior thyroid artery is compressing which course of the nerve, and what is the resultant? Okay, what will be the resultant feature? So the options, 4 options are there, and this is the hint provided. So my dear aspirants, here the correct answer will be tension of vocal cord. Okay, now so for marking this correct answer, the hint which is provided to us is that superior thyroid artery is involved. Which artery is involved? Superior thyroid artery is involved. Superior thyroid artery is one of the branch from the external carotid artery, and it is giving blood supply to superior pole of thyroid gland. It is giving blood supply to superior pole of thyroid gland, which is running along with the external laryngeal nerve. Okay. So, and when we are talking about superior thyroid artery, the external laryngeal nerve is lying close to it. So, in cases where superior thyroid artery is ligated, there can be chance of compression of external laryngeal nerve. Now, we know that only one muscle is getting innervation from external laryngeal nerve of the larynx, that is the cricothyroid muscle. So, there will be paralysis of cricothyroid muscle. Okay, when cricothyroid muscle is paralyzed, the action which is affected is tension of vocal cord is affected. So yes, I am getting C, abduction of vocal cord. Now let me explain, don't worry. So all of you please focus on this diagram. Okay, your doubt will be cleared. See here. Now here you can see along with superior thyroid artery, which nerve is running. So in this diagram you can clearly see along with superior thyroid artery, the nerve which is running is, this is superior thyroid artery, the nerve which is running is external laryngeal nerve. External laryngeal nerve. Got it? Superior thyroid artery. Now here you can see in the lower aspect towards the basal aspect or lower part of the thyroid gland, inferior thyroid artery is running along with which nerve? Inferior thyroid artery is running along with recurrent laryngeal nerve. So two correlations can be appreciated. So everyone, Shweta, Ishrat, Rashul and Shweta, what you can see, superior thyroid artery के साथ external laryngeal nerve traverse कर रहा है, blood supply कर रहा है, it is giving blood supply to superior aspect of thyroid, and lower aspect you can see inferior thyroid artery running along with the recurrent laryngeal nerve, and the blood supply is given to the inferior aspect of thyroid gland. So it is quite clear here. That means when superior thyroid artery will be ligated, the nerve compressed is external laryngeal nerve. When inferior thyroid artery is ligated, the nerve compressed is recurrent laryngeal nerve. Recurrent laryngeal nerve. Okay. So this is clear here now. So this is quite clear. Now, my dear aspirants, as we know external laryngeal nerve, is giving innervation to which muscle? Cricothyroid muscle. Only one muscle is innervated by external laryngeal nerve, that is cricothyroid muscle, and this cricothyroid muscle is when paralyzed, so the action of the cricothyroid muscle is not possible. So cricothyroid muscle, what is the action? Cricothyroid muscle. So let's talk about the action of cricothyroid muscle. The action of cricothyroid muscle, is to tilt the thyroid cartilage forward, that is anterior causing elongation and tensioning. So, this effect will cause elongation. What will be the resultant? It will cause elongation and tensioning of the vocal cord, also slightly adduction. So, it will cause adduction, it will cause tensioning and elongation of the vocal cord. So, this action will be not possible in this condition. So only I am telling tension of vocal cord will be the resultant here. Got it everyone? So, is it clear, Shweta, Ishrat, everyone? Okay. Now, so that is clear. Now, the other important point is to know if the other nerves are injured, like recurrent laryngeal nerve. So, one thing is clear, superior laryngeal nerve divides into, if you enlarge it, you can clearly see that superior laryngeal nerve divides into external and internal laryngeal nerve. This external laryngeal nerve is giving innervation to cricothyroid muscle, and internal laryngeal nerve is giving innervation to the upper aspect of the larynx actually. Okay, so actually what happens, there is the vocal fold, okay, there is a vocal fold and that will divide the interior of the larynx into upper and lower part, okay. So, true vocal fold is lying and this is marking, okay, true vocal fold is lying and this forms a line of demarcation or separation between upper and lower part, and the upper part is getting innervation from internal laryngeal nerve, the mucosa of the upper part, and the mucosa of the lower part, that is the area of the larynx lying below the true vocal fold, is getting sensory innervation from recurrent laryngeal nerve. Other than that, when I am talking about the recurrent laryngeal nerve, it is giving innervation to all the muscles. It is giving innervation to all the muscles of larynx, all the muscles of larynx. It is giving innervation to all the muscles, that is intrinsic muscles of the larynx, except which muscle? Except cricothyroid muscle. Except cricothyroid muscle. So, everyone, is it okay? So, see here, coming to the options. So, sensation, that means we have got D as the correct answer. Now, sensation above the true vocal cord, which nerve? Which nerve, dear? The answer will be internal laryngeal nerve. Internal laryngeal nerve, which is a branch of superior laryngeal nerve. Okay, sensation below the vocal cord is given by recurrent laryngeal nerve. Abduction of vocal cord is done by posterior cricoarytenoid muscle, and posterior cricoarytenoid muscle is getting innervation from recurrent laryngeal nerve. Okay, it's getting innervation from recurrent laryngeal nerve. Got it? Got it everyone? Okay, now let's move on to the next MCQ, that is question number 3rd. A 38-year-old woman comes to her dentist complaining of tenderness and pain in her cheek near the parotid gland, as well as bad breath and a foul tasting mouth at meal times. A radio-opaque fluid is injected into parotid duct system through canalization, and the xylography of the parotid duct confirms blockage of calculus xylolith. What muscle through which the parotid duct passes is most likely causing the stenosis where the xylolith now resides, blocking the drainage of parotid duct? Options are Buccinator, Mentalis, Temporalis or Orbicularis Oris. 4 options are there and you have to mark the correct answer. Question number 3rd. So, the key point here, the key point to mark the correct answer is, the key point is parotid duct system is involved, okay, canalization has been done and it is blocked by the calculus. So, which muscle is there through which the parotid duct is passing? So, which will cause stenosis of the duct? So, options are Buccinator, Mentalis, Temporalis or Orbicularis Oris. So, waiting for your answer, please mark the correct answer. So, mark the answer, otherwise I will come up with the explanation. So, yes, I got an answer from Ishrat Rasool, and my dear Ishrat, you are absolutely right. So, Ishrat is absolutely right. Actually, parotid duct traverses. Parotid duct is also called as Stinson's duct and it traverses. Parotid duct called as Stinson's duct, it traverses through the buccinator muscle. Buccinator muscle pierced by the duct of parotid duct. Okay, buccinator muscle. If I talk about the buccinator muscle, it is pierced by the duct of, it is pierced by parotid duct. Okay, so I would like to show you this diagram. I am enlarging this diagram and very nicely what you can appreciate. Okay, so you can see this diagram here. You can see this is the buccinator muscle. And here very nicely you can appreciate that this buccinator muscle is having this buccinator muscle is pierced by parotid duct, which is shown. So very clear, it is clear to you that the buccinator muscle is pierced by which duct? Parotid duct. Okay. Now, got it everyone? Now, okay, I just also want to show you this another diagram where I just want you to brief about the parotid duct. Okay, so parotid duct is opening. It is also showing in this diagram. You can see this is the whole outline of the parotid gland, and from the anterior aspect, as you can see here, from the anterior aspect, what you can see, this parotid duct is traversing, and exactly this parotid duct is opening, as you can see in the diagram. Exactly this parotid duct is opening. It is exactly opening in the second molar, upper second molar tooth, opposite upper second molar tooth. It is opening opposite upper second molar tooth, as you can see in the diagram, parotid duct. Okay. And it is running over which muscle? It is running over masseter muscle. Okay, buccinator muscle is pierced by the duct of parotid gland, and it traverses through the oral cavity to drain inside the oral vestibule via a small opening which is lying exactly opposite the second maxillary tooth, because upper molar tooths are lying in the maxillary tooth. So opposite that it opens, the parotid duct or the Stinson's duct. So if I talk about the whole of its course, now we know that that parotid duct is a common site where we can see calculus or salolith, and parotid duct arises, as you can see in the diagram, it is arising from the anterior aspect of parotid gland. Then it crosses over the superficial aspect of the masseter muscle, and thereafter it divides medially to pierce the buccinator muscle and open, and where it opens opposite to the second molar tooth, upper. So this is the, in short, the whole course of parotid gland. So duct, write down parotid duct arises from anterior aspect of parotid gland, anterior aspect of parotid gland. Got it? It crosses the superficial, surface of masseter muscle, and then divides into divides medially into its duct and pierces buccinator muscle. What it pierces? It pierces buccinator muscle and opens, we have already discussed, opens opposite the upper second molar tooth. So we have done with this. Now the other options. So my dear aspirants, we have got other options, Mentalis, Temporalis and Orbicularis Oris. So I would like to show you a diagram via which you can appreciate the location of other muscles. So let's talk about the other one, that is the Mentalis muscle. So yes, you can appreciate it, and you can see that in this diagram the Mentalis muscle has been shown. This is the Mentalis muscle. Okay. Now when we are talking about a Mentalis muscle, it's a very small, it's a important muscle causing facial expression. It's a muscle of facial expression, and its function is, okay, it is located on the chin. It is located over the chin, and the function is protrude the lower lip. What is the function? It protrudes the lower lip. Okay, it protrudes the lower lip and elevates the skin of chin. It originates from incisive fossa. So it is originating from the incisive fossa. It arises from the incisive fossa of the mandible, contracts, and it is not pierced by parotid duct. So it is the wrong option. Now moving to the other option. One of the option was temporalis muscle. So in this diagram you can appreciate the temporalis muscle, which is arising, as you can see, from the temporal fossa and fascia, and as you can see, it's a fan shaped muscle. It is a fan shape, or the triangularis muscle, as you can see, and it is attached to, when we are talking, it is originating from the temporal fossa and inserts into the medial border of the coronoid process. So inserting into the coronoid, this will be the coronoid process, and in the coronoid process it is inserting. Coronoid process of the mandible bone, it is inserting. If I talk about here also, you can appreciate that it is not pierced by parotid duct, and it is having innervation from mandibular nerve. It is having an innervation from mandibular nerve, and its function is, so it is causing elevation. It elevates the mandible, that means closes the mouth, and its posterior fibers of temporalis muscle causes retraction of mandible, Okay, so done with this. What is the other one option? The other option is Orbicularis Oris. So here we can see this is Orbicularis Oris. So Orbicularis Oris is surrounding the oral fissure. As you can see, so many muscles are interlacing at this level. And if I talk about Orbicularis Oris, it's a muscle of facial expression encircling the mouth, and it is having an sphincteric action on the oral fissure. It originates from the incisive fossa, and actually so many muscles are lying there, and it is acting. It is also not pierced by parotid duct. And in the case of so what is the basic action? So it is closing the oral fissure, and it is like actions like whistle. It is involved in actions like whistling, kissing, sucking action, and also this trumpet players and all have got this function of blowing. So these are all the functions of Orbicularis Oris. So it is also not pierced by parotid duct. So we have done with this MCQ. Let's move on to the next MCQ. Question number 4. During surgery to remove the gallbladder, that is cholecystectomy, is performed, a surgery resident damages the cystic artery. Okay, damages the cystic artery. Before a clamp is properly placed, the attending physician applies pressure to the free edge of hepatoduodenal ligament of lesser omentum to control the bleeding until the damaged artery is clamped and ligated. Which of the following artery was compressed by the attending physician? So here also the key point is during the surgery. Now what is the surgery? When the surgery is done, the removal of gallbladder is done, that is cholecystectomy, which is damaging the cystic artery, and attending physician applies pressure to the free surface of hepatoduodenal ligament. So hepatoduodenal ligament free surface, the pressure is applied on the lesser omentum to stop the bleeding, and it is clamped and ligated. So which of the following artery is compressed? So that means cholecystectomy is done. Cystic artery resident, the cystic artery before clamp is the attending physician pressure on hepatoduodenal ligament to control the bleeding until the artery is damaged. So the key point is the artery which is damaged is in the hepatoduodenal ligament, free margin of hepatoduodenal ligament. That is the key point. So you have to tell me the right answer, whether the artery is celiac artery, whether the artery is splenic artery, whether the artery is gastroduodenal, or whether the artery is proper hepatic artery. 4 option. And you have to mark the right answer. Okay, so according to you, which is the correct answer, dear? Okay, so my dear aspirants, these are the key points, and the correct answer is proper hepatic artery. Why proper hepatic artery? Because proper hepatic artery is located within the free edge of hepatoduodenal ligament. So proper hepatic artery is located in free margin of hepatoduodenal ligament. So this is the reason that we will mark this as the correct answer. So this is the reason we will go with proper hepatic artery as the correct answer. Okay. And we know that proper hepatic artery is giving right and the left hepatic artery, and right hepatic artery is also giving cystic artery. So the artery which is damaged in this case is, so Ishrat is telling D is absolutely right. Proper hepatic artery is the right answer, because the location of artery in the free margin of hepatoduodenal ligament is giving us the key hint that it is a proper hepatic artery. It's a hepatic artery is located in that free margin. Other than that, celiac trunk is not the right answer. Why? Because it arises from arch of aorta at the level of T12, and it's a big artery, and it is giving so many branches. Celiac trunk is giving the branches like common hepatic artery, splenic artery, left gastric artery. So many large arterial branches are there, and if celiac artery would have been clamped or damaged, so too much of bleeding must have, so quantity was much, and it would be much neighboring structure is damaged. So to control the bleeding until damaged artery is clamped and ligated will not go with celiac trunk. Splenic artery is also not located in the free margin of lesser omentum and nor the gastroduodenal artery. So these above arteries are not located in the free margin of hepatoduodenal ligament. So these are wrong. Only proper hepatic artery is the right answer. Now I would like to show you this diagram where you can see the celiac trunk, which is given at the level of T12. It's a ventral branch. It's a ventral branch of abdominal aorta. Okay, it's a ventral branch from the abdominal aorta, and the branches given by it is the direct branches. It gives left gastric artery. Okay, it gives left gastric artery. It is giving splenic artery, and it is giving common hepatic artery. So it is giving common hepatic artery, it is giving splenic artery, and it is giving left gastric artery. Splenic artery, common hepatic artery, and left gastric artery. Okay, so these are the direct branches. You can see cystic artery is a branch from right hepatic artery, which is a branch from the proper hepatic artery, So proper hepatic artery is the right answer. Let's move on to the next MCQ, question number 5th. A 17-year-old female basketball player lands on her opponent's foot after jumping to rebound the basketball. Her foot is forcefully inverted, and when leaving the court, she tells her trainer that she twisted or sprained her ankle. So, twisted or sprained her ankle. After getting her ankle tapped for support, she re-enters the game. What ligament was most likely damaged? The ligament damage is calcaneofibular ligament, anterior talofibular ligament, posterior talofibular ligament, or plantar calcaneonavicular ligament. 17-year-old female basketball players jumped on the opponent's foot and rebound to the basketball. Her foot is forcefully inverted. The foot is forcefully inverted and twisted. See here, twisted, sprained the ankle. So forcefully inverted is the key point. Twisted and sprained ankle is there. So you have to tell me which ligament is most likely damaged. The options are calcaneofibular, anterior talofibular, posterior talofibular ligament, or plantar calcaneonavicular ligament. So what is the answer, dear aspirants? Question number 5th. Okay. So actually we have to know the most important ligament which is involved here. Actually plantar calcaneonavicular ligament is not the right answer. Why? So I will rule out plantar calcaneonavicular. When we are talking about plantar calcaneonavicular ligament, it is the wrong option. It is also called as spring ligament, and this will be not the right answer because plantar calcaneonavicular ligament, which is called as spring ligament, it is attached to sustentaculum tali to the calcaneum bone, and it is supporting the head of talus. It get attached to navicular bone and it is supporting the head of talus. So it is not damaged. It is not damaged. So these above one, all the three, calcaneofibular, anterior talofibular, posterior talofibular ligament, all these are the parts of which ligament? All these are the parts of lateral ankle ligament. So the correct answer is anterior. The correct answer will be anterior talofibular ligament. Why anterior talofibular ligament? Among the option provided, the most commonly affected ligament in the case of sprain, sprain, actually the mechanism of injury is forcefully inverted, twisted and sprained. So in that case, most commonly anterior talofibular ligament is injured or damaged because the mechanism of injury is similar as a inversion injury in which the plantar flexed foot is involved, and the weight bearing plantar flexed foot will lead to anterior talofibular ligament injury, which is a part of lateral ankle ligament. Now, okay, next to anterior talofibular ligament, calcaneofibular ligament can be involved, And also if the force of inversion is more, and if it is very much, the force of inversion at the injury is much more severe, then the posterior talofibular ligament can be also involved. So it is important for you to know the order how the ligaments are involved. So please write this information. I will show you the diagram also. So write down. Ankle ligament, ankle joint is frequently, it's the most frequently injured joint. Okay. So ankle ligament, so it's a case of ankle sprain. It's a case of ankle sprain, which is commonly seen as inversion injury in which ankle joint is plantar flexed. Ankle joint is in which the ankle joint is unstable. Okay, it's unstable and it is twisted. So the ankle is twisted and plantar flexed, So the ligament involved, the most common ligament, so write down, most common ligament torn or involved is anterior talofibular ligament. This is the most common torn ligament. Okay, this is in 1 number. Followed by it, if the severity is more, followed by this, if there is a severe inversion injury, so the next will be calcaneofibular ligament. Calcaneofibular ligament can be involved. Calcaneofibular ligament. Followed by it, if the injury is of much more level severe, the last to be involved but can be involved. So in that case, the ligament is involved is posterior talofibular ligament. Posterior talofibular ligament. So got it? So that means the ligaments on the ankle joint is on the lateral side is involved. In that, the most common is the anterior. The most common is anterior talofibular, but next to it is calcaneofibular and next to it is the posterior talofibular. So all can be involved, but most common is anterior talofibular. So that is the right answer. Now see here in this diagram, you can appreciate here the ligaments. So lateral ankle. So we have got lateral and we have got the medial ankle ligament. The medial ankle ligament is called as deltoid ligament and it is also having various parts, and same way lateral ankle ligament is also having the 3 parts. So see here the connection. This is the lower end of, actually this is the lateral malleolus, lower end of fibula. Posteriorly extending from lateral malleolus to that of talus is posterior talofibular ligament. Anterior extension from the lower end of the fibula, that is lateral malleolus to the talus, is called anterior talofibular ligament. This is most commonly torn. This is most commonly involved or torn ligament in case of ankle sprain. And the other one is calcaneofibular and posterior talofibular. The strong deltoid is a very strong ligament on the medial side, so it is not involved in case of ankle sprain. It is also important, before proceeding to the next MCQ, I want you to know the parts of deltoid ligament also. It is also important that you should know the parts of deltoid ligament, the strong medial ligament. So let me just enlarge this. So actually the same way here also you have got, this is the lower end, this is the medial malleolus. This is medial malleolus. Okay, this is medial malleolus. Okay, this is the medial malleolus. Got it? This is the medial malleolus. Now, from the medial malleolus, you can see 2 extensions. One is proceeding backwards here and one is going anterior here, which I have shown you with the green color. So this is anterior tibiotalar and this is posterior tibiotalar. So that means this is extending from the lower end of tibia to talus anteriorly and posteriorly. These are the parts of deltoid ligament. We are talking about parts of deltoid or medial ankle ligament. Now, you can see the other one, you can see the extension from lower end of the medial malleolus and going towards the sustentaculum tali. This is called as tibiocalcaneal ligament. Tibiocalcaneal ligament. So this is tibiocalcaneal ligament. This is tibiocalcaneal ligament. Now, here one more here one more extension is there, which is extending from the lower end of medial malleolus and going towards the navicular bone, navicular tuberosity. Okay, this part is called tibio-navicular. This part is called tibio-navicular. Now, one important ligament which I want you to brief is the spring ligament. So here, see here, this part you are seeing here, this part is called as the spring ligament. So this part of ligament which you are seeing is the spring ligament, which is also called as plantar calcaneonavicular ligament. Plantar calcaneonavicular ligament. Okay. So this plantar calcaneonavicular ligament or spring ligament is traversing, moving from the sustentaculum tali of the calcaneum bone and attaches to the navicular bone. Okay, navicular bone from the plantar aspect. So it is also giving support to head of talus. What is the function? The function is it is supporting the head of talus. It gives support to the head of talus. Done, my dear aspirants. So let's move on to the next, that is question number 6th. An unconscious 2-month-old infant is admitted to the emergency department after an automobile collision. Emergency tracheostomy has to be performed. Which of the following structure is most likely at a higher risk of injury during this procedure? The options are left brachiocephalic vein, left common carotid artery, vagus nerve, phrenic nerve or thoracic duct. Which is the correct answer? We have got here 5 options. Okay, unconscious 2-month-old infant is there, 2-month-old infant is there, automobile collision, emergency tracheostomy has to be done, and in this procedure which is the most dangerous structure to be injured? Options are A, left brachiocephalic vein, left common carotid artery, vagus nerve, phrenic nerve or thoracic duct. So your time starts now. Please mark the correct answer. Okay, 5 options are there. Please mark the correct answer. Question number 6. The correct answer is left brachiocephalic vein. Left brachiocephalic vein is the correct answer. Let me show you. Actually, a tracheostomy when is performed, it is done basically at the level of 6th cervical vertebra. 6th cervical vertebra. It is given at the level of 6th cervical vertebrae, near the cricoid cartilage. What is the level? It is given. It is done near the cricoid cartilage, and at this level, the left brachiocephalic vein is crossing the trachea immediately anterior to brachiocephalic trunk. So at this level, left brachiocephalic vein is crossing. It crosses the trachea exactly immediately anterior to brachiocephalic trunk, exactly anterior to brachiocephalic trunk, and the vein is more superficial, so most likely it will be damaged. So the most common structure to be damaged in the case of emergency tracheostomy is the left brachiocephalic vein. See here in this diagram, this is the left brachiocephalic vein, as you can see, this one, and you can see it is just crossing anterior to trachea. So the structure will be damaged here will be left brachiocephalic vein, which is exactly in the midline. Other structures and the other options which is given is not correct, and the reason is left common carotid artery, the vagus nerve and the phrenic nerve is not situated exactly in the midline of the incision of tracheostomy. So that is the reason these are not the correct answer. If I talk about thoracic duct, it is also not the correct answer because it is lying posterolateral to esophagus and it can't be injured when tracheostomy is done. The most common structure to get injured will be left brachiocephalic vein. In the diagram, we have appreciated the relation of left brachiocephalic vein traversing just anterior to trachea. Let's move on to question number 7. Which is true in respect to trapezius muscle? Which of the following statement is true in respect to trapezius muscle? Innervated by dorsal scapular nerve, superior fibers retract the scapula, middle fibers elevates the scapula, inferior fiber retract the scapula, superior inferior fibers act together to rotate the scapula on the thoracic wall. Which is the right answer, dear? Question number 7th. Okay. So yes, I got an answer from Dr. Oreo, A and C, A and C. Okay, okay. So, which is true? We have to mark one only as the correct answer. So, here the correct answer, question number 7, the correct answer is superior and inferior fibers act together to rotate the scapula on the thoracic wall. So, E is the correct answer. So, my dear aspirants, superior, when we are talking about superior and inferior fibers act together. So, the correct answer will be superior and inferior fibers act together to rotate the scapula on the thoracic wall. So, that is the most correct answer. Okay, that is the most correct answer. Now, trapezius muscle, when we are talking of trapezius muscle, the innervation of trapezius muscle is by spinal accessory nerve, that is 11th cranial nerve, and it is composed of 3 fibers. Trapezius muscle is composed of 3 fibers. Okay, this trapezius muscle fiber, superior fibers will elevate the scapula, superior fibers will elevate the scapula, middle fibers will retract the scapula, inferior fibers, please note down. In the case of trapezius muscle, superior fibers elevate the scapula, middle fibers retract the scapula, inferior fibers depresses the scapula. So, this is the action. And when the superior and inferior fibers act together, they will rotate the scapula, So, correct? Is it okay everyone? Ishrat, Dr. Oreo, everyone? So, let us move on to the next MCQ. Question number 8. Now, before that, I would like to show you this diagram. Here you can see the trapezius muscle and you can see superior fibers. This will be the superior fibers which is causing in upward direction. So, this will cause elevation. Middle fibers will retract, inferior fibers will depress it. So, this is the whole arrow is designating the whole action of the trapezius muscle. Now, let us move on to the next question number 8. Which of the following is not a branch of second part of maxillary artery? Which of the following is not a branch of second part of maxillary artery? Okay, we have got following branches. We have got deep temporal, we have got labyrinthine artery, we have got pterygoid artery, we have got masseteric artery and buccal artery. 5 options are there, mark the correct answer, which is not a branch of second part of maxillary artery. Okay. So, here the correct answer is labyrinthine artery. Labyrinthine, when we are talking about labyrinthine artery is a branch of basilar artery. It's a branch of basilar artery. It is not a branch of maxillary artery. It's not a branch of maxillary artery. So, we have got B as the correct answer. Labyrinthine artery is the correct answer. It is not a branch of second part of maxillary artery. Rest all deep temporal, pterygoid, masseter, buccal, these are muscular branch of the second part of maxillary artery. These are muscular branch of second part of maxillary. Yes, Farad Parvez, you are absolutely right. Now, see here. Labyrinthine artery is a branch of basilar artery which is a part of vertebral arterial system. If you will see, I will just enlarge this image. You can see two side vertebral arteries are joining. So, this is also vertebral artery and this will lead to the formation of, as you can see, this will lead to the formation of basilar artery. Okay, this will lead to the formation of basilar artery. So, what you can appreciate here that the branches of basilar arteries are, so you can see the branches of basilar arteries: anterior inferior cerebellar artery, superior cerebellar artery, posterior cerebral artery, and that of pontine artery and that of labyrinthine artery. See here. So, these all are superior cerebral artery, anterior inferior cerebral, labyrinthine, pontine and posterior cerebral, the terminal branch. So, these together are the 5 branches from the basilar artery, and clearly we can see that labyrinthine artery is a branch of basilar artery. So, here all of you can revise the formation of circle of Villus. So, you can see here, if you will see this diagram, circle of Villus is posteriorly formed by posterior cerebral artery, posterolaterally. So, this is forming its posterior boundary, posterolaterally by posterior communicating artery, laterally by ICA internal carotid artery, anterolaterally by anterior cerebral artery and anteriorly by anterior communicating artery. So this diagram is very clearly explaining you the formation of circle of Villus and showing you that labyrinthine artery is a branch of basilar artery, not maxillary artery. But the question is about maxillary artery, so let's quickly revise the branches of maxillary artery. So maxillary artery has got so many branches, okay, it is having so many branches. It is divided into three parts. First part, second part and third part by lateral pterygoid muscle. Lateral pterygoid muscle is the key muscle which is dividing the whole course of, which is dividing the entire course of the maxillary artery into three parts, and we have got 5 branches from the first part, 4 muscular branches from the second part and 6 branches from the third part. It is important to understand all the branches. So see here, now seeing the first part branches. So if I talk about the first part, first part, so branches from the first part, we have got middle meningeal artery, accessory middle meningeal artery, deep auricular artery, anterior tympanic artery and inferior alveolar artery. So these 5 branches are the branches from which part? These 5 are the branches from the first part of maxillary artery. From the second part, muscular branches, masseteric will be there, buccal will be there, temporal will be there. From the third part, we have got the branches are pharyngeal artery to pterygoid canal, infraorbital sphenopalatines, posterior superior alveolar palatine arteries. These are all branches from the third part. Don't worry, I will write the name so that you can revise. So my dear aspirants, the branches of the first, second and third part can be memorized by a mnemonic. So you can by a mnemonic you can memorize the branches, okay, you can memorize the branches. Okay, so how many first part? So first part branches of maxillary artery. So maxillary artery, the mnemonic is Maeda. The mnemonic is Maeda. Maida, you know, it's a flour, white flour used for cooking. So M for middle meningeal artery, A for accessory middle meningeal artery, I for inferior alveolar artery, D for deep temporal artery, and A for anterior tympanic artery. So done with the first part. Now we will talk about the second part branches. Branches of the second part. Write down branches of second part of maxillary artery. Branches of second part of maxillary artery. So we have got 4 muscular branches and you can memorize by make dinner before party. Make dinner before party. So here make dinner before party. So here M, D, B, P. Make dinner before party. So M for masseteric artery, D for deep temporal artery, B for buccal artery, P for pterygoid, lateral pterygoid artery. Okay. Now what is left? The third part. What is left is the third part. So okay, third part. So we have done with the branches of first and second part, and let's move on to the third part. Branches of the third part. So I am just enlarging this and I will write here branches from the third part. Branches from the third part of maxillary artery. PGI pass. So here PGI pass. P for posterior superior alveolar artery, posterior superior alveolar artery. G for greater palatine, G for greater palatine artery. I for infraorbital artery. Another P for pharyngeal artery. A for artery to pterygoid canal. A for artery to pterygoid canal. And this S for sphenopalatine artery. S for sphenopalatine artery. So yes, this is the mnemonic for branches of third part of maxillary artery. So is it okay, everyone? Everyone, is it okay? These are branches from the third part of maxillary artery. Okay. So yes, done with this. Now let's move on to, so we have done with the branches. Now let's move on to question number 9th. Okay, question number 9th. All statement considering fibular collateral ligament are correct except which of the following statement is wrong about fibular collateral ligament? All statement about fibular collateral ligament is correct except which is wrong? Which is a wrong statement? Which is the wrong statement here about fibular collateral ligament? So yes, your time starts now. Please mark the correct answer. Which is the wrong statement about fibular collateral ligament? Okay. It splits the tendon of biceps femoris. It is superficial to tendon of popliteus. It is connected to lateral meniscus. It is rounded and cord-like. It extends from lateral epicondyle of femur to the head of fibula. So these are 5 options. Please mark the correct answer. So my dear aspirants, the wrong statement is it is connected to medial malleolus. Actually, when we are talking about the lateral ligament, collateral ligament, when we are talking about the lateral collateral ligament or fibular collateral ligament, it is separated from the menisci by popliteus tendon. It is separated from the menisci, lateral menisci by popliteus tendon. So C is the wrong statement. All other are correct. So if we want to talk about the general features of the collateral ligament, fibular collateral ligament, that is lateral collateral ligament, which is also called as lateral collateral ligament. Okay, this is rounded cord-like and it is a very strong ligament. It extends from the lateral epicondyle of femur and is attached to the head of fibula. If I talk about the tendon of popliteus muscle, it is passing deep to fibular collateral ligament and it is separated from the lateral meniscus. It is passing deep to fibular collateral ligament and it is separated from the lateral meniscus. The tendon of biceps femoris, the tendon of biceps femoris, the tendon of biceps femoris is splitting it into 2 ligaments. Okay, it is splitting this ligament into 2 parts. Let me show you the diagrams. Okay, see here, this cadaveric image will show you the whole extension of this ligament. As you can see, this is the lateral or fibular collateral ligament which is extending, as very clearly you can see in this diagram, very clearly you can appreciate in this diagram that it is extending from the lower end of, this is the lower end of the lower lateral epicondyle of the femur and this is the head of fibula. It is extending from the head of fibula to that of the lower end of fibula head and to the lower end of femur, lateral epicondyle. The other thing is biceps femoris muscle. If you can see here, biceps femoris muscle tendon has been shown and you can see here this is attached and it is lying collateral to the lateral collateral ligament. Popliteus muscle, you can see here, this is the popliteus muscle, it is separating, it is not letting it attach to the lateral meniscus. Other than that, you can see this is the popliteus tendon, this is showing you this popliteus muscle and you can see here it is forming a separation. So this is the fibular collateral ligament and it is separated from the menisci because of the attachment of popliteus muscle. This is the reason it is not generally injured. Question number 10. A 45-year-old woman is admitted to the hospital with a difficulty of breathing. Radiologic examination reveals a tumor invading the lung surface anterior to the hilum. Which nerve is most likely compressed by the tumor to result in dyspnea? to result in dyspnea. Okay. So, question number 10th, options are A. Phrenic nerve, B. Vagus nerve, C. Intercostal, D. Recurrent laryngeal, and E. Cardiopulmonary. So, we have to mark the right answer here. So, here the key point is, okay, Oro A. Phrenic nerve, absolutely correct. Oreo, absolutely correct. Phrenic nerve is the correct answer. Why? Because we have tumor is invading the lung surface anterior to hilum, and in this option we have got, in this options, phrenic nerve is passing anterior. Relation of phrenic nerve is anterior to the hilum. Vagus nerve is posterior to the hilum, so it is not the right answer. Intercostal nerve will be intercostal space. Recurrent laryngeal nerve has got different relation on right and left hand side. On the left hand side it is arching around, left side it arches around the arch of aorta, on right hand side it is arching around subclavian artery through the hilum. Okay, so only one of the nerve in the option is passing anterior to the hilum, that is phrenic nerve. So see here, relation of phrenic nerve and vagus, you can see here phrenic nerves are passing anterior. So you can appreciate phrenic nerve is passing anterior to the hilum, and the vagus nerves are passing posterior. Vagus nerves are passing posterior to the hilum area. Got it? Okay. Now my dear aspirants, let's talk about, okay, so All India NEET PG test is going to happen on Feb 26. Feb 26 is the date where All India mock test is going to happen. So 9 AM is the timing. Get enrolled in All India mock test. Use the code NAT10 and do present for the test. Okay, use the code NAT10 and do present for All India mock test and get enrolled for this test. You will be also provided with video lectures of all the explanation of all the MCQs which is asked here. Other than that, introducing the new thing on the Unacademy platform, that is notes. Okay, so notes of NEET PG will be given with free with 1 year. So it's not now free, but I want you to give information. It was still valid till 21st Feb that it was getting free with 1 year of subscription. But if I want you to give information, the notes are on, and if you are going to take the subscription, you will definitely be provided with the notes of Unacademy, which is made by the top educators of Unacademy. High yield MCQs, table charts, flow charts, images, latest clinical guidelines, high quality real time images has been used. This will be very, very useful for you. So get in, use this code and take 10,000 discount. So 10% discount. This will be highly beneficial. My dear aspirants, I would also like to tell that boost your medical preparation by taking the subscription. So it is valid till 23rd Feb. Till 23rd Feb it is valid, that by taking 3 months of subscription, 1 month is free. On 12 month of subscription, 2 month is free. On 24 month, 4 month is free. On 36 months, 6 month is free. Actually, I am now starting a special class. So all those who are interested, 7:15 PM is my special class. So you can join me for the special class. So you can join me on the Unacademy app for the special class. This is also an MCQ session, and you can enroll by using the code NAT10 if you have yet not enrolled for the special class. So you can use my code NAT10 and you can be present for the session. This will be highly beneficial for you. Okay. So these are the information which is given by me. So and also, my dear aspirants, I would like to tell everyone that those who want to take the subscription, so use the code NAT10 and get an extra discount of 10%. That will be highly beneficial. And all the aspirants who are watching the session, do like, subscribe and share. Let's crack NEET PG platform. So today I want to give the information starting in another 10 minutes on the Unacademy app platform, special free platform class. So you can be present live for the session, MCQ session. 8 PM on the Unacademy Future Doctor, I am coming up with the learner discussion that will be followed by MCQ session. So do join for me, do join in this session. You can be present live for the session. This will be highly beneficial for you. All the best, my dear aspirants. So let you see in the special class. Okay, thank you so much. We will again meet with the upcoming session. So this session will continue for another 2-3 days, and we will continue with the sessions. All the best. Keep studying. Thank you so much. Okay.